can have every Lyme symptom in the book, fatigue, brain fog, joint pain, and still be told you're fine, but still sick. And if your Lyme test came back negative, you can have the Lyme symptoms, over 40 main symptoms. And your doctor may still be telling you, hey, it's fine, it's all in your head, quit looking on the internet. And that's because the standard Lyme tests your doctor uses were designed decades ago to detect acute infections and not the chronic or relapsing ones that people struggle with today. They rely on your immune system to create antibodies. But wait a minute, Lyme can actually suppress that very response. And when the bacteria hides deep in the tissues or changes the shape, in my opinion, there's multiple phases. It becomes invisible to traditional testing. So even if you have Lyme, your results might say negative. And that's how thousands of people end up being dismissed or misdiagnosed or told it's all in your head. Now at the West Clinic, we do things differently. We don't just look for a single test result. We look at your whole system, your immune balance, your blood under the microscope, and your body's communication signals, because that's where the truth lives. And in this video, I'm going to show you why standard tests fail, how Lyme disguises itself, and the smarter ways to uncover what's really going on in your body. So if you've been searching for answers, stay tuned, because this is finally connecting the dots. So let's get into the standard tests that often miss Lyme disease. I think a great baseline is to do the standard test that you do for any sickness. Now, this isn't specifically for Lyme disease, but these are things like a complete blood cell count with differentiation, a complete metabolic panel, a total iron, a high IHS C-reactive protein, a vitamin D levels. Now, those aren't testing for Lyme disease, but here's the key to helping Lyme disease, and that's by getting everything in balance. There's no such thing as a lotion, a potion, a pill, a prescription, an IV, an injection, an herb, a homeopathic that fixes Lyme disease. But a lot of those treatments help people that are out of balance get into balance, and that's how you win against this disease. And it's so frustrating when patients are doing the conventional testing and literally they're told, hey, you're fine. It's all in your head. Or, we don't believe in Lyme disease. I hear that a lot from people. I'm like, what do you mean? It's not a religion. It's just the facts. So here's what's happening. We have some outdated technology like ELISA and Western Blot because these were designed decades ago to detect acute infections, not chronic, not the relapsing, and not things when you're doing fine, all of a sudden you have a flare-up or you go down. Because these tests rely entirely on your body's antibody response, which the Lyme bacteria can actually get in and fake. So what I tell people is this. With chronic Lyme disease, you don't produce enough antibodies or trigger a positive result. And then you can have the classic symptoms of literally right here where we're talking about debilitating fatigue, persistent brain fog, widespread joint pain, and I feel that the most common Lyme symptom of all is disrupted sleeping patterns. I believe that Lyme bacteria finds its way to the pineal gland and disrupts your melatonin cycle and literally turns you into a vampire, which means you're exhausted during the day and you can't sleep at night. And I really think it's part of that melatonin response, which is part of the inflammatory system, and the side effect is that it makes you sleep. So one of the best things that you can do is the testing. Like I'm not opposed to a Western blot or ELISA test. I like the IGeneX test is really useful. And I like, all the supporting tests. There's advanced tests to do, but my favorite test is this one right here. And that is the medical microscopy. It's a research project that we do at our office. You're going to see an example of it in just a minute because we're looking for the 5 phases of Lyme disease. Now, in traditional medicine, they're like, hey, it's a spirochete, it's a bacteria. You have to have a tick transmission, and then your bullseye rash and 2 weeks of doxycycline and Rocephin. Most people are healed. But if you have Lyme disease, you know that that's usually not the case. Those are the lucky minority. And actually what happens, I feel, is the Lyme is kind of like a caterpillar and butterfly. It morphs and it goes into different phases. The spore phase, the intracellular phase, the budding phase, and the biofilm phase. And that corkscrew-shaped bacteria, I feel that it can literally screw into organs and tissues and your lymphatic tissue, and it's hiding from the bloodstream, hiding from the antibodies. And that's why I feel that the best test is this one right here. the microscopy test. So it's a research component where we have an interview, we talk about an environmental exposure. Have you been around ticks or anywhere where there's ticks? Did you have the bullseye rash? A lot of people don't remember the rash, or it's an area where they just can't visualize it. That's one thing. Then we look at blood tests. Then we go through any hormone testing, and we go through environmental testing. We try and figure out where is the barrier to healing. Because I believe that there's a lot of people that have been bit by a tick and exposed and have no symptoms. And the reason why they don't have any symptoms is because their terrain or their immune system is doing what it's supposed to. When you have a barrier to healing something and blocking it, and that clever little bacteria morphs into these different phases. So here's why traditional tests fail. They have bacterial evasion. Lyme bacteria are masters of the skies. They hide deep within the tissues. Testing too early before antibodies develop is a problem. Testing too late when the immune system has been depressed is a problem. There's variability in the labs, and some of them are testing for strains that literally aren't there, and they're missing strains that are. And then they're missing the CDC criteria, which was originally designed for disease surveillance and tracking, not for clinical diagnosis. So here's what happens when you have things like that. We have 50% of tests are false negative. It usually takes 3 to 5 years to diagnose, and it's 10 plus doctors and specialists. Just the other day, I was doctor 31 on a patient. I've been doctor 27. I've been so many times people said, hey, you're double digits, and it's real debilitating symptoms, and they're repeatedly told it's wrong, or you just need a happy pill, or we don't know it's wrong, or they get a different diagnosis like chronic fatigue syndrome, or you hurt all over, so it's fibromyalgia. And we know from the British Journal of Medical Practitioners, a study that says that chronic viral and bacterial infections cause neurobehavioral, neurodegenerative, psychiatric, autoimmune, and fatiguing illness. So let's unpack that a little bit. Your nerves don't work right. They start to behave differently. It messes up with your mental state, anxiety, depression, cyclic mood disorders, melancholy, bipolar disorders, I think can all be caused by a chronic infection. And then it mimics autoimmune disorders. So many times we've worked with people, MS symptoms. We've worked with their rheumatoid arthritis symptoms. We've worked with their Hashimoto's. We've worked with ankylosing spondylitis and Sjogren's disease. And we've changed the terrain and put their bodies back in balance. And guess what? We see really nice improvement. So Lyme's many diagnoses and disguises. Rheumatoid arthritis type symptoms. Chronic fatigue is a big one. Fibromyalgia, nerve problems, and just really, really hard on your moods and emotions. And look, your mind is here and your body's here, and they come together like this in this beautiful, complex organism that is you. And if your mind is not healthy, it's hard to be healthy physically. When you're physically not healthy, it's hard to be together mentally. So you got to treat everything all together. Why we do things differently at the West Clinic. Look, 80% of the diagnosis in medicine comes from the history. Then you do your baseline testing. Then we do our medical research policy where we look at your blood under the microscope and we can see the 5 phases. Matter of fact, you guys, let me take you inside the office. Everyone inside the West Clinic, and we're talking about tests for Lyme disease. And I didn't know until I was reading this book that there's actually 5 phases of Lyme disease. And there's the spirochete phase, the intracellular spore budding, and biofilm. And that's one of the reasons I feel that Lyme disease testing labs is so notoriously difficult, because we're really only testing for 20%, 1 of 5 life cycles. That's why inside of the office, we do this. We do a research project of medical microscopy. So we're looking at your history, your labs, what treatments you've done, other medical diagnoses, and then we use this as an additional viewpoint. And you can see things like right up here, you can see things like this inside the blood, the spirochete right in here. And that, when you add that to all of the different testings, I feel now we have a really solid plan forward of changing the terrain, making sure there's no barriers to healing, and then putting systems in place that really help the body to heal. That's part of the way that we do things differently at the West Clinic. So when we see microscope, we can even do advanced testing and look at, again, what are the barriers to healing? The barriers to healing. Heavy metals can be a factor. Mold and fungus are a huge factor. Microplastic, environmental toxins, and hormone imbalances all make it so that the Lyme disease gets a second lease on life. Now, the most important thing is, if you're across the street or across the country, I just really hope that you hear me on this. Whoever you're working with, and if you are your own doctor, you've got to treat you. That's not a disease protocol. This is, hey, I got to do everything I can to put things in balance. Minerals, vitamins, hormones, stress management, movement, following the 5 rules of health. Matter of fact, my latest book, book number 9, is the 5 rules of health: water, food, water, movement, and how we treat and how we talk to ourselves. So that philosophy literally drives everything we do at the office. A diagnosis of Lyme disease is just the beginning of the conversation. It's not the end. That's when we do literally Humpty Dumpty medicine. You know, the story of falling off the wall and in pieces. We put the pieces back together. Every Lyme journey is unique. Everyone is different. A toxic burden, a nutritional stress, imbalances, not being able to sleep. That's why cookie cutter approach often fail. So here's a smarter way to look at these. If your body can't recover, is it the immune problem? Is it the spleen? Is it the thymus? Is it the liver and the kidneys? The detox pathway is not working. Is it our inflammation patterns? And are we developing multiple chemical sensitivity or MCAS and our nutrient levels? So many times people are trying their very best to eat and they're not absorbing what they're eating. And so you deserve real answers. So if you suspect that you have Lyme disease or undiagnosed healthcare condition, if your symptoms are real, let's go through the system. We are helping so many people across the country, Canada, Australia, Africa. Your symptoms are real. Your suffering is valid. And the frustration of being told everything is normal is so frustrating. When they tell you that and you know that you're having real symptoms, what they're really saying is, I don't know how to test and I don't know how to treat you. So it's not me, it's you. So if you're interested in the next step, here's what we can do to help. LymeFighter.com. You're going to hear about it in just a second. We'll review your history, your current symptoms. And our commitment to you is this: every patient deserves an individualized attention, evaluation, a clear treatment plan, and unique to your healing methods. If your Lyme test came back negative, but your symptoms are real, don't lose hope. The test didn't fail you. It simply wasn't built to see the full picture. And the truth is, Lyme doesn't just hide from your immune system. It hides from standard allopathic medicine. That's why finding the right team and the right system makes all the difference. At the West Clinic, we've developed a comprehensive Lyme fighter system, a step-by-step approach that looks at your entire body, not just the test results. So whether you're across the street or across the country, we can help you get real answers, rebuild your health, and finally move forward. And if you're ready to stop guessing and start healing, go to www.lymefighter.com. You'll find resources, the next steps, and a way to connect with our team directly. I mean, let's beat Lyme together, because healing happens when you treat the whole person, not just the disease. So if you're ready for clarity, lymefighter.com. No guessing, just personalized testing and care that looks at the whole you.